Hi, I'm Mary Jo. I have been a nurse for, hold on to your hats, 51 years. I have lost over 100 pounds as a postmenopausal woman and most importantly, reversed all chronic disease in my life. I absolutely feel wonderful and a little full of myself because I came from this fabulous exercise class where I was bicycling and rowing and weightlifting and oh, it just filled me with so much exuberance. I just need to find myself a mountain to climb. Anyway, I was asked today, well, what do you eat? What kind of plan do you subscribe to? And I really don't know how to answer that question. The best way to answer it, if you're at all interested, is I like to call myself a Nutritarian. That is to say, my intention is to make every bite count for my own well-being and health, and I plan to eat a very high nutrient plant-based foods. Now, what do I mean by plant-based foods? Well, obviously mean in my case no meat products. Should people never imbibe in meat products? Well, let's face it, from the beginning of time, some people have. And from the beginning of time, is it appropriate in certain circumstances to help that being thrive? Question mark, question mark. I do not imbibe in meat products because I'm very concerned that the protein in meat products increases IGF-1, insulin-like growth factor 1, which encourages atherosclerosis, which was a big problem that I had. Visceral fat, another big problem that I have. Angiogenesis, which can actually encourage cancer development. So far as I know, not a problem I have, but when a cancer diagnosis is achieved, it has to do with things that have been going on for 30 or 40 years. It's not just what you ate today. But I am hoping, because I ate such a highly processed food diet, I am so ashamed to tell you, and a conventional meat up the yin yang, and loved going to restaurants at one point in my life and ate the most junk I possibly could find. It all culminated in obesity and serious chronic disease, and always having lots of infections, and all of that is gone, and I feel great. I think I demonstrated that at the beginning of this video. I just feel so wonderful, and I just hope that anyone who has a question for me or requests my help, that I can impart total respect for who and what you are. I think when it comes to the meat eating issue, the second part is saturated fat is a primary constituent of LDL and low and oxidized LDL particles that produce the atherosclerotic plaque. And so I don't really need any of that. I don't really think saturated fat is much required in the diet. Now, you might say, well, if you eat nuts, there's some saturated fat in nuts, so what do you think about that? I try to eat more seeds because I think they are more nutrient dense. I do have some nuts on occasion, particularly walnuts, because of their amount of omega-3s in them. I think makes them a healthy choice. And of course, I absolutely love pistachios. Now, I don't eat pistachios hand over fist, but if I can find a reason to have just 3 or 4 pistachios, I will, but not every day even, because I mean, look at me. You can't really tell because I'm sitting down, but on a good day I'm 5 foot 1 inch tall. I mean, I'm just a very small person. I'm supposed to be a very small person, and so I'm also 72 years old, so my metabolism, it's good, it's bad, it's all over the place, but I don't think anybody of my genre can eat the same amount, nor desires to eat the same amount of food as when they were 20 years of age. So I try very hard, because I've made so many big mistakes in terms of nutrition in my life, which is very embarrassing since I'm a nurse, but they don't teach you. They don't teach you in medicine, in nursing, probably not in PA school. They do not teach you the real science of nutrition. And I mean, there are nutritional protocols to treat COVID. Did anybody hear about that on the news? No, it's just put your mask on and stay at home and drive yourself crazy. So, anyway, there are probably nutritional protocols that actually work for almost every disease entity. Now, if you're like me and you imbibed in so much junk food throughout your life, I think it's really, really important I eat the most nutritionally beneficial food possible to prevent that cancer diagnosis, which could still occur because of how many mistakes or how much lack of nutrients I provided for myself. So I don't think I have a lot of wiggle room for error. Now, the China study identified that people who ate a little bit of meat and lots of produce, and the people who ate lots of produce and no meat, both had the same health outcomes. So there could be circumstances where eating some sort of animal product is beneficial, especially if someone isn't thriving. But be careful, because I had a lovely friend, and she was more overweight than I was, poor darling. She's still kind of falling apart. I just feel bad for her because she's a lot younger than I am as well. Well, anyway, she did vegetable, fruit, plant-based eating for a week. She felt so sick that she stopped, and now she's on a keto diet, and she feels better. Now, you might say, why is that? Well, it's because she stopped her detoxing with the highly acid food in meat that she's currently eating, which is unfortunate. Why did she feel so bad? So some people might think, oh, I feel so terrible. I have no energy. I feel sick. I mean, all sorts of wild symptoms happen when you're detoxing. So you have to get through the detox period to know if you are thriving on this diet or not. And I think almost everybody does. Now, there are people of my age who have a bit of a damaged GI tract, and they actually can't seem to assimilate amino acids very easily, and therefore a little bit of animal products is appropriate. But you got to recognize that there are some issues between the saturated fat and the protein that increases IGF-1. Now, if you eat a few nuts and seeds, particularly nuts, they do have some saturated fat in them. So what is the difference between a nut and a steak? Well, when you eat some nuts, they are very slowly digested and very slowly absorbed. So, assuming you're not overeating for what your metabolic needs are, that saturated fat goes in very slow and is easily, the body can now take it up and create energy out of it instead of putting more fat cells in your body. I find that most intriguing. My son has been working really hard on a plant-based diet, and he had some problems with uric acid, and I kept saying, well, animals and alcohol. Well, he did imbibe in some alcohol, but he didn't eat any animal products, so we were kind of all perplexed. More recently, I've recognized that certain sugars, processed fructose, if you will encourage uric acid production as well. And uric acid production, when it is excessive, can cause problems with encouraging cytokines and inflammation in the body. And I think it diminishes the body's ability to, yes, make nitric oxide, which I've been making such a big thing out of for a couple weeks now. Anyway, so what is a Nutritarian? Well, a Nutritarian is really someone who ascribes to Dr. Joel Fuhrman's philosophy, and he is my favorite Dr. Guru nutritional scientist that I have ever read, because of the scientific information he provides just makes so much sense to my brain. And I have been so successful, and I've lost tons of weight, and I'm not regaining it. I should lose a little bit more, but one step at a time. Anyway, there you go. Well, be careful. I shouldn't say lose weight. I just want to be the healthiest possible person I can be for as much junk food eating as I chose to do in my past. Sometimes I call myself a wannabe Nutritarian because a true Nutritarian is either normal weight for what their body needs them to be or is still losing weight, albeit very slowly. And I guess I could say I'm more Nutritarian than not because I keep finding that when my weight goes up a little bit, it used to go up to 65, and then it never went, it would come down, it kind of goes back and forth, and then it would never go past 60, and then it would never go past 50, and now it never goes past 40. I mean, it goes down, and it seems to, and it's beginning to focus itself in the 130s, and as soon as I get down to 110, I will be a happy camper, and so will my knees, because I feel great most of the time, and my legs work great most of the time, but I have had some problems with osteoarthritis, and I had been so overweight with a severe vitamin D deficiency. I'm just lucky that I'm in as good a shape as I am right now. So, but every time if I go off plan and I center myself back on it, I find, gosh, my knees feel great. I just love that it seems like I am beginning to override all the problems, health problems or issues that I had. So someone who eats a nutritarian diet, at least the way I interpret it, is I try to make GBOMBS the focus of what I eat. Greens and cruciferous vegetables, legumes, which is the beans, onions. Gosh, I've just fallen in love with onions, and I used to think I hated them. Red onions, chives, scallions. Those green onions. Green onions, they've got the white onion and the green. So, it's like 2 for 1. What a great little invention out there. Green onions, who would know? Mushrooms, all sorts and kinds. Good idea to cook them because they have a little agent in them that has been found in animal studies to be carcinogenic. So if you cook it, it pretty much is eliminated. Let's see, it got down to a second B is for berries, cherries, and pomegranates. That is absolutely delicious food. Listen, all fruit is good. I make different things with bananas, with apples, I always think some citrus fruit like oranges. I really like mandarin oranges a lot. And now, summertime, plums, peaches. Sometimes I'm trying to make this a vegetable-based diet. Sometimes I have to rein myself in because I do not want to be eating a fruit-based diet. But all of the fruit out there, basically, the only fruit that's not that I know of, well, actually, there's another one I know of. Apparently, there's something called a cherimoya. I never had it, don't know anything about it. Apparently, that is not particularly healthy to brain health, but that's all I know about it. So do your own research. And the one thing is grapefruit. Now, I got it all wrong. So I found out, let's say you're on a very serious medication. Well, you ingest medication, it does what it's supposed to do, and you take another tablet the next day and the next day, and the idea is your body detoxifies it in the liver and eliminates it, right? Well, if you eat a lot of grapefruit, it slows down and inhibits the detoxification center of the liver. So the medication you're taking will have higher and higher levels in your blood that could actually allow it to become toxic. So particularly if you're taking medications, be careful about the grapefruit. I used to think the grapefruit must be like with Coumadin. I know a gentleman that became toxic on Coumadin, and they said stop eating grapefruits. And so I thought, well, maybe the grapefruit stops abnormal clotting. No, no, it just prevents the liver from detoxifying as it should. Very interesting, don't you think? And then finally, seeds and nuts, with my emphasis on seeds. I also review what I've eaten every so often because I need to be concerned about the caloric density. I mean, I don't need a lot of food. Oh, gosh, wished I did. But also eating this way, and don't let me sound like I don't eat anything else besides GBOMBS. For example, sweet potatoes. I love to eat sweet potatoes once in a while. So there are other vegetables and fruits that are not specifically related to the GBOMB anagram, but I still will enjoy them from time to time. I like to focus on those foods that really empower your immune system, prevent cancer, and reverse the chronic comorbidity diseases. And the foods that are highlighted for that, but not exclusive, are your GBOMBS. There, there have been also people who have had good luck with watermelon and helping them to feel better. I've also read that if you get off of all caffeine and you need a little morning lift, eat watermelon. You will get your morning lift from the watermelon. But if you ever have any problems with sleep, please don't eat it in the evening, or you might be wired on watermelon. Who would have thought that possible? So I hope this makes sense. When people say to me, are you a vegetarian or vegan? I say not really, because you can be a junk food vegan very easily. There are studies of vegans that did not do well in terms of like bone and muscle health. And when you peruse what were they eating, what were they calling plant-based, there would be, for example, a lot of potatoes, a lot of white potatoes, possibly noodles, and foods that are very low on the nutrient dense spectrum. And therefore, when you looked at their entire diet, there was nutrient deficiencies in it, which explains why their health outcomes were not as stellar as was anticipated. So remember that it's very important to find the correct nutrient density and caloric density to your personal metabolic needs. Well, I hope you found something you enjoyed listening to. I thank you so much for your time and attention. Remember, this should be all about you, because you are so important to the rest of us. So with great gratitude and appreciation in my heart, I thank you for listening. Have a beautiful day, and goodbye.